Hi there, this is Nicolas Van Mieghem from the Thoraxcenter. I'm standing here with my colleague Roberto Diletti, who presented the one-year data from FFR SEARCH as a late-breaking trial. So Roberto, maybe why don't you summarize what was FFR SEARCH?
Well, FFR SEARCH was a prospective registry evaluating what is the FFR post-stenting using a novel device that is a microcatheter FFR. Is a rapid exchange device, so it's very easy to use on the wire that you use for PCI. So basically what we did is to measure the FFR in any case that we were performing, so in any possible case with PCI. The results was quite interesting, I think, because what we have seen is that when we perform a PCI and we think that the result is angiographically good, actually we can have a low FFR value. And that was pretty true for what we think is a significant FFR. In more than 8% of the patient, the FFR post-stenting was below 0.8. But even it's important to think about what is the suboptimal FFR post-stenting. So in 40% of patients, the FFR post-stenting was less than 0.9. And what we have learned in the past from retrospective studies is that probably even an FFR less than 0.9 could be related to worse clinical outcomes in those patients. So we were evaluating the outcomes in patients with an FFR post-stenting less than 0.9, and what we have seen is that we have an important trend towards worse clinical outcomes in patients with an FFR that is less than 0.9. And especially we have seen that myocardial infarction is already significant at 1 year in the population with a less than 0.9 FFR post-stenting. We should remember that this study was powered for 2 years clinical outcomes, but already at 1 year we have a strong signal and we have for MI a significant value.
Yeah, and if you look at the Kaplan-Meier's of the endpoints, what is happening there? Is there a trend? Do you see something changing over the first year?
So what we see is that up to 6 months, basically all Kaplan-Meier's are going in parallel and they are very similar. After 6 months, they start diverging. And what we have seen is that they are diverging more and more over time. For myocardial infarction, we had also some events very early that were basically triggered by stent thrombosis. And in those cases, we had in the Kaplan-Meier's already at the beginning, at the early phase, the two curves diverging, and then even more after 6 months. So I think that these data are interesting in the long terms. We need to see the long-term follow-up of this data and looking at those curves, how they are diverging. Because the first 6 months, they are going pretty the same. Patient with an FFR that is optimal or an FFR that is less than 0.9.
So it's going to be interesting to see what's going to happen between 1 and 2 years. And the results for the 2-year follow-up will be available probably next year around this time, correct?
We hope to present EuroPCR.
Yeah, so and I think that with FFR SEARCH, the questions already come up, and should we not work on a randomized study? And this is exactly what we did in Rotterdam. So we are now doing this single-center randomized trial where we look at IVUS-guided optimization of the FFR in patients with an FFR post-stenting below 0.90. And Jules Damen is heavily involved and leading this project. We'll see what's going to happen there. But I think the concept of PCI after stenting is very, very appealing and might affect or might help us interpret stent results. And maybe we can start predicting then outcomes in our patients. So that said, Roberto, thank you very much.
It was a pleasure.
And hope to see you soon.
Thank you.